Hey ho, it's Simple Lines Anatomy. We've been getting a certain question a lot, and it's about self treatment, what you might call self massage, under that kind of vein, rolling, foam rolling, so massage, foam rolling, and even implement use. Maybe this is a percussor or some kind of a tool that you might use for flossing, those kinds of things. And we're not against it by any means. We think it can be used well in the right hands. And in the right hands, it often comes to understanding of how to do it effectively. Now, blanket statement, we don't necessarily recommend doing it. In fact, as a general statement, don't do it. But if you choose to do it, that's your decision, and you should do it as good as you possibly can. You should make an informed decision should you choose to do so. Now that I've absolved myself of all liability, I can say a few things. So, if you're wanting to massage yourself, work with a foam roller, work with some kind of implement, there's three main things that we think are important. You need to be gentler than you normally would. You need to be aware of what's in the area, and then you need to be balanced in your performance, in your actual self massage. So, let's see if we can do these things kind of one by one. So when it comes to being gentle, there's a few elements to this. Understand that there is a big difference between you doing a massage versus someone else doing a massage to you. So one kind of classic example that's frequently brought up is that when you stub your toe, let's say there's your toe and there's a crafty table leg somewhere around here, oof, dastardly thing, that table leg. It's always popping up out of nowhere in the middle of the night to destroy your toe, and oof, it actually does a really good job of that. It's shocking how well it does at that. But there's that table leg, and there's maybe a big impact point right about there. Ouch. That kind of hurts. Hopefully it's not bleeding, but it might get a little bit red. Your first instinct is what? What do you do when you stub that toe? Typically you rub it. That's everyone. Everyone ever since the beginning of time, as far as I remember. And that's got to mean something. Our natural reactions have to mean something. It can't be nothing. And there's actually a simple reason for that. It often goes under the name of gate control theory or pain gate theory. But the premise, even though that's a theory, the premise is reasonably understandable. A signal is sent up in the form of pain. And regardless of the fact we haven't worked out the actual gate mechanism in the pain gate theory, the fact that it is still a theory, this still mainly works. There's a signal sent up in the form of pain, but then when we rub it back and forth, a signal is sent up in the form of mechanical stimulation. And that's like pressure, vibration, some different forms of sensitivity. But in any case, what it ultimately results in is that the mechanical sensation will block out the sensation of pain. It will essentially stop that from happening, essentially cutting it off from the source so it doesn't get reported through. And this is a neat effect. It's important mainly because of the fact that if we were in too much pain to run away from whatever hurt us, we might get eaten by that thing that hurt us. If we got bit and there was so much pain coming through into our awareness that we couldn't effectively run away because we didn't know where our foot was in space, we wouldn't survive for nearly as long. So this is a normal, developed thing. And the finer points elude us at this point, but it still works. Now, why did I say that, though? What's really the point behind this? When we stub our toe, we rub it. It means that when you are the one doing the massage, the self-treatment, you can push your body just a little bit farther than when someone else does that same thing. There's, again, another reason for this. So looking back at our example here, understand that if you are the person having the massage, you've got your rippling biceps. Ooh, there you go. Those are good. There's some triceps in there. And you're having some kind of a treatment, a massage-based treatment done to your arm, it can be taken to points of stretch and strain. And because you yourself are not doing the massage, you've only got the input of the tissue. So you've got the feedback coming in from the tissue. That tissue is sending a signal back to the CNS. And that's great. What that will do is the CNS will be aware of that input coming in, and it can interpret the sensation of pain, translate that through pain, and initiate a muscular spasm, potentially, should we need to push the person out or to tell the person to stop. This is a very important thing that will happen. And certain fields like fascial stress therapy, manual therapies such as osteopathy, pay attention to this thing they might call a barrier or a resistance. And it's telling you as a practitioner, don't do that anymore. And maybe you as the patient will also say, hey, don't do that anymore. However, there is a difference. When it's us doing the treatment to ourselves, we're still getting feedback into the CNS. And we've got this, let's say we've got this other hand doing the treatment here. We've got it doing something, rubbing, pressing fairly hard. But it, in of itself, is adding mechanical stimulus into the system. And even though it's not in the same area, it's still a mechanical stimulus. It cuts down, not entirely, but it cuts down on the sensation of pain here. It can reduce the activation or the awareness of that into the central nervous system. And it means that when you work on yourself, and this is an interesting thing, but when you work on yourself, you can push that much harder. You can do that much more to the tissue. And in fact, this may be too far. It may cause strain, it may cause pain, and you may not be fully aware of it. Some of it will come through, but you won't be aware of all of it. So you can surpass to the point of strain in that tissue. And once that starts to happen, even though you may have done some beneficial release, even though you may have rubbed and rubbed and rubbed and rubbed and rubbed, and it's softened the tissue up, overstrained tissue is irritated tissue. Now it's angry. And irritated tissue adds more painful feedback after the fact into the CNS and results in more of an exaggerated muscle contraction. This means that the end result is that more tension exists in the tissue we're trying to fix. So excess leading to reversal of what you're trying to do. And this takes a lot. It does take a lot. It's not instantaneous. It's not like you just over rub slightly and it's all ruined. It's not how it works. But that can happen if it's done improperly. This is true of doing it to yourself, but as well when you are doing it to another person. These same rules apply. But it does unfortunately become a little bit easier to do it to yourself. Okay, next point that we want to make. Let's get rid of that. Get rid of that. Talk about this. We have to be aware of what we're doing. That is incredibly important. Our awareness of what is going on in the human body really defines a basic level of safety. Anatomy is one of the first lessons, and it should be one of the last lessons, because anatomy will tell us what we can do to an area, how far we can push it, and what kind of negative effects we could have should we do something. And that's in the case of a traumatic injury, that's in the case of this self-massage here, or just as we develop and age, as we do stuff. So this will help us understand why it's important to be gentle in certain areas more than the other. The neck is going to be a good example for that. And I've done videos on this area before, of course, but there's some really important things that go through the neck and why it's such a good example. And it's because everything has nerve, artery, vein, and lymphatic in it. I'm going to say nerve and artery are your two main ones, but if you press too hard on a vein, you can still get a blood clot, so that's a real issue. So let's just compare. Let's just say we have an arm. An arm is certainly an important appendage, and it's got, let's say, a few nerves running, more than a few, but it's got a few nerves running through it. And, we've got our radial nerve coming through that way. We've got a median nerve coming through there. The ulnar nerve's shooting down, and it's doing its whole thing. It's coming around cubital fossa and all that. Exciting stuff. But they're very covered by muscles, and this is a kind of a neat feature. We've got a big bicep in the way, for instance, all that there. We got a big tricep in the way. Ooh, what a mess. In there. And if you go on the inside of the arm, yes, that is an exposed spot. But the nerves, by comparison, are, relatively small compared to other regions. So you can do a lot to the arm. You can hurt it. You could press on this hard enough. You could push really, really hard on that nerve and cause some real irritation. But it takes a bit of work. So this is a safer zone, let's say. Because these are motor nerves, they're sensory nerves and motor nerves. They're going to have an effect on the arm muscle. If you do it for too long, obviously it's going to reflux back into the rest of the body. But this is motor and sensory. In the neck, however, we have some arguably more interesting nerves. We have our vagus nerve coming down, and that has a lot of sensation to viscera organs. We also have the coolest nerve in the body from C3 to 5. Which is the phrenic nerve, coolest nerve in the body. I'll say that again. A close second is the radial here, but we'll talk about that at a later time. But these nerves actually control a lot of heart and lung function, a lot of digestive function. And so if we were to press on those really, really hard, we could see alterations in communication of that system. And this is not something unheard of. This is very dangerous and something only medical practitioners should ever do. But understand that doctors will stimulate that vagus nerve through the neck in certain situations, and it is a way of doing that. So consider for a fact, if you were to rub on that neck really, really hard, you can have an effect on the way the vagus nerve works. You can have an effect on the way the phrenic nerve works, the breathing apparatus. Therefore, and these are not things we want to interrupt. You could have an effect on the sensation of how nausea, how stomach, and small intestine and the liver and the gallbladder and spleen, how all those are perceived in the body, and that can truly be dangerous. That is a very bad thing to do. So understand that all of these nerves and then any blood vessels through the area, because of course we've got a subclavian there, and we've got a subclavian artery there too, or we have a brachial and splitting into a radial ulnar artery in the arm. These are all responsive. They are responsive to pressure for sure, because like anything else, they can be compressed on hard enough to be injured. They'll have a fascial sheath around them. Any one of these will, really. Nerve, artery, vein, lymphatic will all have some kind of fascial sheath, a protective layer around them. They're not just hanging out there loose. And if you impact it hard enough, you can damage it. This is how we start to grade nerve injuries too. The highest grade has damage to the fascia, which is considered in many cases irreparable. Permanent nerve damage can result on that. So they're responsive to pressure, and in the case of arteries and veins, they're responsive to occlusion as well. If you press on those hard enough, you can actually stop their blood flow entirely. Same reason why you don't check the carotid pulse on the same side, or check both carotid pulses at the same time. It's a very bad idea for reasons which I hope are obvious. So with enough pressure, this creates pain in there, it creates irritation too. And see, these are things we want to avoid. Now in this specific case, consider how much of a danger the body would think this is. Consider how it might think something very bad is happening. When we're pressing on nerves, when we're going after nerves, we're going after the source of pain. And this is kind of no matter where we are. Again, maybe the arm is going to be less sensitive to it, but it's still sensitive to it. You don't really want to press it too hard. Gentle is above all else the safest way to go about things. But when we get to an artery or a vein in this area, if you start to occlude that, the body believes itself to be running out of blood. And that's dangerous. So a very reasonable response from the body would be sympathetic, fight or flight response. This is totally understandable in that case. And so we can actually have a lot of pain and irritation but we can as well have an exaggerated fight or flight response, a sympathetic response. And this is the exact opposite of calming. And generally, when we're doing self-treatment, whether it's massage or rolling, a fight or flight response, the opposite of relaxation, is not what we're going for. So this excess can lead to the exact opposite state, physically and potentially mentally, that we are trying to achieve. We want to avoid this if possible. So being aware of where you're working and what's in that area, understanding just a bit about the anatomy, is absolutely essential. Okay, last point. We also have to be balanced in our approach. Again, this applies to the general practitioner as well as someone who's working on themselves. So just understand that all of the tissues in the body, all of them, every single one, they are calibrated at least partially to length. That's not everything for them, but they are calibrated to length. So a really simple example is how the head sits. And I could do so much better than that, and I will now. So there we go. There's a head. It is sitting on a atlantoaxial joint, and below that we have our many vertebrae, but we're just going to represent them with a few simple lines. Hey, oh, wait a minute. Yeah. Okay. Anyways, with a few simple lines, we get an idea of what's going on. Now, understand that the ideal location for weight bearing, the place the body wants to have weight borne, is ideally through the center, right through the middle, right on the bony structures. The bony structures are best for dealing with pressure because they are made to do so. So everything wants to put the weight back to the middle. Now that can be the ligaments, because there's going to be a ton of ligaments all surrounding these structures, binding them together. There's going to be ligaments all up and down, left and right, front and back, and we have different names for these spinal ligaments. But that's not the big deal. This is true of any joint. Bones should take on the weight. They're made to withstand it. Muscles support movement, of course, but they want to keep it in the middle. So let's say we have muscles on either side, and we have many of these, especially when it comes to the neck, because we are precariously balancing our head. If we drift that head from one side to one side, and it stays there, it tends to be that the muscles opposite that direction, really simple way, just the opposite side, so the right side in this case, because we're looking at it from the back, they will contract in an attempt to bring that head back in place. And we could say the same thing about the opposite side. If we went to the opposite side, the opposite muscles would attempt to right that back. And this is true when we're moving, of course, but it's just when we're standing still. It's kind of happening and recalibrating at all times. So this means that as we alter our position, alterations cause recalibration. And that's recalibration of the muscles, but of the nerve tone as well, because there will always be nerves coming off and going to these muscles to power them. And they will be, in fact, be constantly recalibrating. So as we change the length of the muscles, the nervous system changes and the muscle will change correspondingly. We have to be careful though, because when we're performing some kind of a self-massage, or we're rolling, or we're using an implement that's made to soften fascia, whatever it happens to be, whether it's a hand or a percussor or like some kind of a plastic scrapey tool, that has all kinds of cool names, and I'm all for them if used properly. But as we use these things, we can be overzealous at times. We can cause too much loosening, over loosened tissue, and what is really unstable tissue by overworking it. And again, we can do this because if we're not gentle, if we're not aware, we can destabilize the tissue because we're not sensitive to its changes, because we're doing it to ourselves. It becomes irritated. And this again will create more muscle tension. All of this softening, all of this increase in instability gets reflex back to the central nervous system, back to the spinal cord, back to the brain as well. and it will want to compensate by ramping up nerve tone. It will ramp up nerve tone, and then it will go back to the muscles in an attempt to stabilize. And if we've overloosed, in fact, we can't stabilize. So we will just be unstable for too long, and it will actually require more muscles engaging. We'll have to start engaging more muscles to get the same effect as previous. So we'll start adding more muscular contractions, more than we had before, and so we can again create an excess of muscle tone, which is ultimately the exact opposite of what we wanted to achieve with our self-treatment. And these are good principles to understand, really, at any point. Again, whether it's for yourself or it's for someone else. These are really simple things that we can follow. As usual, I hope that made sense.